We were also very much interested in the cost of the test. We wanted to make sure that the cost of the test would not put unnecessary difficulty or burden on the passenger. Now, we quickly looked at what is being charged across the globe. So when you go to a place like Zimbabwe, you pay about $210 for the test. In China, you pay about $150 for the test. And they are doing PCR, which is a very good test that identifies the virus itself. And in China, after paying $150, you have to wait for about 6 hours average before you get results. When you go to Togo here, you pay about 150 euros, not dollars. In Benin, you are paying about 150 euros. In fact, I just got the figures for Nigeria. You pay about $130, and not only that, you have to go to a hotel and wait for results, which can be 1 or 2 nights. So if you are paying about $100 for the night, in all you are spending close to $300 for just making sure that you are safe of the virus or free of the virus. Now, so with all these considerations, remember that anyone coming to Ghana must have a negative PCR test. On the average in Europe, if you should enter a lab, not even the airport, to do a PCR test, you are looking at average 100 euros. So what do we do in Ghana, or how do we look at it? So we sat down and looked at a solution we have. Now, there is a good reason why a PCR test is the most preferred, or one of the gold standard. It's because it tells you that the virus is present. And not only that, but for academic purposes, it can give you some parts of the virus that over time, when you put together, you can have what we refer to as a complete genome, which is the whole map of the virus. Here at the airport, forgive me, it's not about academic research. We are interested in 2 things. The test must be very specific and sensitive, which means it must tell us that this guy has the virus if he has it. And if the test says it's negative, really, you pose no risk to Ghanaians. And we got a solution that was checked at Noguchi, checked with FDA, checked with Ghana Standards Board, and came out with a specificity and sensitivity rate of between 99 to 100%. Now, secondly, we also were interested very much in the time, the turnaround time, how long it takes to get the results. And after going through a lot of testing, we had a minimum of 12 minutes, maximum of 30 minutes. And with these 2 indicators, we now had to decide whether $150 of having the 2 most important requirements met is reasonable or not. And when we considered other things, we thought that comparing this figure to others around and what you would have spent, I think let me take my time to speak about this. Before this reopening, we had evacuation and special flights coming to Ghana. Any passenger who got on board actually paid for 2 weeks of hotel bills before coming to Ghana. And if you are paying an average of, let's say, even $70 a night, you have to multiply $70 by 14 days. The cost far overwhelms what you charge for, the test we are doing right now. Secondly, if we should keep you here for 6 hours, for the other test regimes that takes 6 hours, it will pose a risk of congestion at the airport, which in itself will serve as an incubation chamber for possibly a sharing of the virus amongst passengers. So the factors tell us that it is actually proper or prudent to go with this regime. Thirdly, remember that when Ghana first quarantined travelers in this country, and we picked over 100 and so cases, we actually tested them twice. And each PCR test we did cost an average $70 to $100. So Ghana spent close to $200 on one person to make sure that the virus is not brought to Ghanaians. And so for the passenger to pay $150, which is less than what we paid, and we fed them as well, I think it is a very good bargain. If you want to come to Ghana, we as a government are interested in you coming, but we don't want you to come here with the virus. And by the way, nothing is more expensive than getting a virus, because it can lead to a critical illness and can lead to death as well. And when we start comparing the prices, I believe you agree that to pay $150 and keep Ghanaians safe, it is worth doing that. And it's going to be borne by the passenger. I think this is important. The cost is going to be borne by the passenger and not the state, not the taxpayer. And I believe after all the considerations, we were good to go. We even are looking at, out of the 150, some percentage coming to Ghana Airport Company Limited, the civil aviation, the port health, because this involves a lot of logistics accumulation and all that. So I am convinced that this is worth it.